Hello, and welcome to our video series on hypertensive disorders of pregnancy. We are a team of physicians, educators, and individuals with lived experiences who designed this series to teach others about hypertensive disorders of pregnancy. This is the first video in the series and will focus on an introduction to hypertensive disorders of pregnancy. High blood pressure, or hypertension, is defined as a blood pressure that is greater than 140 over 90 millimeters of mercury. However, it can also just mean a blood pressure that is higher than your normal. The top number, or your systolic blood pressure, is the pressure in your blood vessels when the heart pumps. The bottom number, or your diastolic blood pressure, is the pressure in your blood vessels when the heart is relaxed. Hypertension affects more than 1 in 5 people 20 years and older in Canada. Hypertensive disorders of pregnancy are also very common, affecting around 10% of pregnancies worldwide. These are important to know about because they can have significant impacts on both the pregnant person and baby during pregnancy and after delivery. Hypertensive disorders increase the risk of delivering early and cesarean section delivery, and they can lead to prolonged stay in hospital. After delivery, both the postpartum person and baby have an increased risk of cardiovascular disease, including developing chronic hypertension. This is why it is important to ask your physician about hypertensive disorders of pregnancy. Hypertensive disorders of pregnancy include a spectrum of disorders, all involving high blood pressure. HELP syndrome can also be a severe form of preeclampsia, though it can be due to other illnesses as well. Chronic hypertension means that you had high blood pressure before pregnancy or before 20 weeks of pregnancy. In gestational hypertension, preeclampsia, and eclampsia, you have developed high blood pressure after 20 weeks of pregnancy. In gestational hypertension, there are no effects on other organs. If this develops into preeclampsia, you may have other organs affected, most commonly seen by having protein in your urine. Eclampsia occurs when a person who has preeclampsia has a seizure. There is still a lot that isn't known about why people develop high blood pressure in pregnancy. Currently, research suggests that blood vessels in the placenta develop differently, causing them to get less oxygen to the placenta than what it needs. This then leads to a chain of events resulting in damage to the pregnant person's blood vessels in different areas of the body, including the kidneys, the liver, the heart, and the brain. That is why people can experience a wide range of symptoms and effects from hypertensive disorders of pregnancy. Check out our next video to learn about what factors make people more likely to develop high blood pressure in pregnancy and what can be done to help prevent it.